And so we just finished screening the waiting room and had our follow-up discussion. I want to get our thoughts from Guy here. What's your biggest reaction from seeing the film?
It felt absolutely true to life. It's just the environment I work in at San Francisco General Hospital. These are the stories of the patients I interact with every day. These are the faces of my colleagues in the film. They're in the East Bay. We're in the San Francisco General Hospital, but it's the same. It's the same story and really well told.
What would you say your biggest takeaway was from seeing the film and the follow-up panel discussion?
There's a lot of good people trying to do a lot of good work, but our system is so broken. It's so profoundly broken. It's going to take a lot of work to implement any kind of change. And passing the Affordable Care Act is one huge big step in the right direction, but implementing it is going to be a major fight. And our community is going to have to continue to do a lot of grassroots organizing and pushing because it's not going to happen otherwise.
I'm here with Marie after the panel discussion and movie screening of The Waiting Room. Marie, what was your biggest takeaway from seeing the screening?
I think it was really real because I live that Monday through Friday, and I see people coming into the clinic every day who's feeling like they don't have nowhere to go, they're in pain. And I think for me, I don't take it personal. And it's something that you can't take personal because you know that they haven't, probably been in a clinic and seen a doctor, especially males, for years. And they need services.
And after seeing the panel discussion, what do you feel is being done? Do you feel that enough is being done now in the community to address those issues?
I think things is being done that we don't see, but there's a lot more that needs to be done.
So I'm here with Judith to get her reaction after the screening of The Waiting Room and also the panel discussion. So what was the biggest scene for you after seeing the screening of The Waiting Room? Biggest scene that touched you?
I think the young girl that had strep throat, and the thought that went through my mind was, how come there isn't something like San Francisco General's urgent care there to take care of that? Because there was no reason for that young girl to have to wait hours and hours and hours to find out she had strep throat.
So true.
Home in bed.
I know. What do you like about the Affordable Care Act, as it is a step in the direction of universal health care, single payer? I know more steps can be done.
I think that we're yet to see what. I think it's going to depend on if it really is affordable for a lot of people. And I was disappointed in that healthcare insurance has always been so exorbitant. Like, I was a carpenter, and a lot of time a union carpenter, so my health care was covered, but after all the years of paying into the system, at the end of it, you don't have anything. There's no little bank account that says, oh yeah, you've been putting, and you never used it. You never had to do anything. And now, before I turned old, I was paying $450 a month for nothing. You know, I never went to the doctor, and now, if the Affordable Health Act is actually affordable, it'll be great. But that's not what I've seen so far. You know, all the insurance companies are jacking up their, you know, the spiel. Yeah.
Well, I appreciate you sharing with me, Judith, and your perspective, and thanks so much. No problem. Thank you. And so our final take on the screening of The Waiting Room and the panel discussion. I have Ken here. What's your biggest takeaway after seeing the screening?
It just shows how dysfunctional our system is. I was just in a conversation with a couple of gentlemen who've traveled abroad, and they talk about their friends in Sweden and Finland who have socialized health care. Everybody's covered. And I, having practiced Chinese medicine for 25 years, I listened to the panel and nobody really talked about where that fits in there. I'm about to, I work with people with cancer and diabetes and who are obesity, and they talk about prevention, but it seemed like they talked about the very early part of prevention, trying to get these young kids to eat right and get people to eat right. And they talk about the very latter stages of urgent care and emergency care, but nobody talked about that person who's a borderline diabetic, that person who's obese and starting to suffer some of the problems of being obese, whether it's diabetes or high blood pressure or just joint problems on their knees and hips. And these are the issues that I address and I see every day. And so I'm still at a loss. Where am I going to fit in this new ACA, Affordable Care Act, Obamacare, whatever you want to call it? Highland is in every major city in the country. Highland is in little rural places that only white folks live in the middle of Mississippi, and they still dealing with that problem. And so it's just not us. It's just people who don't have any money. And I understand the cultural significance that Sister talked about, the supervisor talked about earlier about being cultural competent and how much that means, having worked in the Bayview, having worked in Mission Neighborhood Health Center, having worked in Maxine Hall Health Center.
You mentioned that you practice Chinese medicine, and I know there's a lot of debate, but also a lot of more acceptance on bringing Eastern medicine into Western medicine. How have you been able to do that thus far?
Well, insurance companies are being more cooperative. I think it's a financial issue that they feel like there's billions of dollars each year being spent on complementary medicine, Eastern medicine, alternative medicine, and those funds they want to be part of. They want to get part of their piece of that pie. So they're beginning to cover it more, which is giving it more, giving the general public more accessibility to it. So that's one reason. Kaiser sees that it is a benefit, so they refer patients to me. And I'm a lot of my patients are Kaiser patients. But other doctors are beginning to see the benefit of my ability to work with their patients to help them with specific chronic illnesses, whether it be cancer and they're dealing with chemo or radiation, and being able to stay on that regimen versus getting too sick doing the medication and having to take a break from it, which makes the medication less effective.
I really appreciate what you offer, because I think what was referenced in the panel was a lot of wellness, and I think bridging the Eastern and Western practices of medicine allows more wellness. Because again, it takes care of the comprehensive patient. Having that medical home needs to have Eastern and Western practices as well. So I really appreciate what you do and appreciate what you shared.
Thank you. Thank you.
Thank you so much.